Keto diet in diabetes. Keto diet is a much talked about and tried topic today. It's mostly recommended at health clubs as a part of their weight reduction programs. Being a practicing diabetologist, it is one of the most commonly asked questions at my outpatient. First, we must try to know what a keto diet is, and then what are its good and bad effects on health and also in patients with diabetes and certain other diseases. Now, what is keto diet? A keto diet is an eating plan that focuses on foods that provide a lot of healthful fats, adequate amounts of protein, and very few carbohydrates. The goal is to get more calories from fat than from carbohydrates. The diet works by depleting the body of its sugar reserves. As a result, it will start to break down fat for energy. This results in the production of ketones that the body uses for fuel. When body burns fat, it can also lead to weight loss. The idea is to get more calories from protein and fat and less from carbohydrates. You avoid most of carbohydrates that are easy to digest like sugars, soda, pastries, and white bread. It is important to know that ketogenic diet is a short-term diet plan that is focused on weight loss alone. A keto diet may help you lose more weight in the first 3 to 6 months because it takes more calories to change fat into energy than it does to change carbohydrates into energy. There are so many benefits in following a keto diet for a short period. At the same time, there are a lot of ill effects if it is continued for a longer period and also in trying keto diet in patients with certain illnesses. First, let us see what are the benefits on trying a short-term keto diet. Weight loss in obese patients is the most important benefit noticed with keto diet. Weight loss occurs by boosting metabolism and reducing appetite. It may also reduce hunger stimulating hormones. Keto diet may reduce the risk of certain cancers and hence it is safe and suitable complementary treatment to use in patients undergoing radiation and chemotherapy. This is because it causes more oxidative stress in cancer cells than in normal cells, thus causing them to die. Insulin is a hormone that lets your body use or store sugar as fuel. Keto diets burn this fuel quickly so you don't need to store it. These lower levels of insulin will help protect you against some kinds of cancer or even slow the growth of cancer cells. It was also noticed that some people who are on a keto diet had a significant drop in levels of total cholesterol, LDL cholesterol, and triglycerides and an increase in HDL cholesterol, otherwise known as good cholesterol. Some studies also show that the ketones that are generated during keto diet provide neuroprotective effects and thereby can strengthen and protect the brain cells and nerve cells too. Hence, keto diets were found useful in patients with epilepsy, Parkinson's disease, and sleep disorders. Since ketogenic diets lower the amount of insulin, it is also found helpful in controlling polycystic ovarian syndrome. It was found that ketogenic diet improved several markers of polycystic ovarian syndrome, including weight loss, hormone balance, ratios of luteinizing hormone and follicle stimulating hormone, and levels of fasting insulin. Now let us try to understand what are the side effects or bad effects on being on a keto diet. Keto diet limits a person's daily carbohydrate intake while increasing amounts of fat and protein. The aim is to encourage body to burn fat for energy instead of carbohydrates. This metabolic change puts the body into a state of ketosis. Ketosis occurs when body starts to break down fat due to a lack of blood sugar circulating in the body. Most keto diets limit daily carbohydrate intake to 50 grams or less. Such sudden reduction in carbohydrate diet may cause a side effect called keto flu, whereby they experience severe fatigue, insomnia, nausea or vomiting, severe constipation, headaches, dizziness, etc. The potential risk of a keto diet include severe vitamin and mineral deficiencies. High fat, high protein diet can also cause kidney stones, fatty liver, low levels of protein in blood. The people with certain health issues like pancreatic disease, thyroid conditions, liver conditions, gallbladder removal or disease, and history of eating disorders should ideally not follow a keto diet. There are also reports that it may cause digestive issues and changes in gut bacteria. It is also known to damage bone health. Now let us see what keto diet does to type 2 diabetes, whether it is useful and whether it really helps in type 2 diabetic patients. Keto diet can reduce blood sugar, but that doesn't mean it's right for everyone because controlling carbohydrates is important to manage type 2 diabetes mellitus. It may seem that keto diet would be ideal for people with diabetes, but that's not true. There is a lot more to consider while suggesting keto diet to them. Ketoacidosis is a condition which is commonly seen in type 1 diabetic patients and also occasionally in type 2 diabetic patients, where ketones build up too much in blood and thus turning it acidic. This happens when sugar levels are too high and insulin levels are inadequate. Diabetes related ketoacidosis is a very dangerous condition and can even be life threatening. Hypoglycemia or low blood sugar is another commonest problem noticed among diabetic patients following keto diet. When you look at the pros and cons of keto diet on diabetic patients, pros could be that the blood sugars can be managed well. It is effective in controlling obesity and excess weight gain, whereas cons may be a high risk for hypoglycemia, lack of essential nutrients to the body due to restricting certain food groups, constipation due to lack of fiber content in the diet. It can also cause unpleasant side effects like dizziness, bad breath, nausea, headache, fatigue, confusion, excess thirst and hunger, fast heart rate, chills, etc. Studies showed potential elevation in LDL cholesterol while you follow a low carbohydrate diet and hence risk for cardiovascular disease, cancer, and Alzheimer's disease. In pregnant women on keto diet, it is often shown that the child had a neural tube defect. Though keto diet may show many potential benefits in diabetic patients, following it requires pretty serious commitment and care. And also it has its serious side effects and complications too. Hence, I suggest for people with diabetes a more moderate decrease in carbohydrates may be a more sustainable and safer approach to blood sugar control than a ketogenic diet. Thank you for your patient listening.